Good morning from PCR London Valves 2023. My name is Pamela Gatto and I'm here with Francesco Maisano, course director of PCR London Valves. So Francesco, this is the third edition of Simulation Lab here at PCR London Valves. So tell us more, how does it work?
Simulation Lab is an important addition to the program. As you know, London Valves is the meeting for the heart team, and Simulation Lab is the place where everybody can play a role. The Simulation Lab is a very practical room where we discuss hot topics. We go into the details of some specific techniques using a number of tools. We use anatomical specimens, we use simulators, we use imaging modalities. We try really to go deep into the discussion using the simulator as a tool to improve communication in between peers. So it's the place to share knowledge, to learn some tips and tricks, but even more importantly, to connect with the global community.
So a lot of materials and a lot of people. How many people are involved in this simulation lab, counting everybody, the peers and
Yeah, more than 100 people are working in the simulation lab background. You don't see that probably, but there is a lot of work, a lot of preparation. Almost all year long we work in preparation for this simulation lab. There are a number of track leaders, program producers, a number of trainers. We have a vital training system to raise this community. Because it's a different way of learning, different way of sharing knowledge, and I think is also creating value for our community. So it's a lot of work, but it's worth it, and it's a great opportunity really to have hands-on procedures.
I agree with you, and Simulation Lab is evolving during the years. So what's the news for this edition?
So first of all, Simulation Lab per se is evolving with adding new tools, new things which have been done this year. For instance, we have some collaboration with LifeTech, with bringing this pulsatile model for some mitral and tricuspid procedures. We have a great simulator for basilica, which is, as you know, is a complex procedure, and we go into the details of this procedure. We really understand by watching directly with the camera what happens on these leaflets. We really understand how to run this procedure safely and effectively. So there are many additions, but what I would like to mention is that if you go around the London Valves, a number of colleagues, a number of training village industry partners, they also increase the level of the educational offer. There are some of our partners who are doing amazing simulations, amazing learning opportunities in a continuum between the simulation lab, learning room, the hands-on room where people can actually touch devices and do some procedures, and then the training village where everybody is invited to have experience with specific devices, and this is offered by the industry partners who are able to deliver the best education specifically for their own technologies.
I perfectly agree with you. This is a nice environment, but it's just in London Valves, or what happens after London Valves?
Yeah, we as PCR, we believe in the role of simulation as a tool to enhance communication, learning experiences and sharing of experience. For this reason, PCR took a decision already 1 year ago to establish a new brand, which is called PCR Simulation Learning. This new brand means that there are activities which are ongoing all over the year based on simulation, not only during the meetings, but also some certification modules. So you can apply online, for instance, on a transeptal course that we have in Milano, 2 days full immersion, hands-on training on transeptal with certification of skills. We also will establish new projects in the next few months. We have some edge-to-edge Transchede edge-to-edge programs, the so-called Alfieri bootcamp, where people will come and not only play on simulators but also really engage with a community of people who are learning these procedures, and many others are coming. So stay tuned, because simulation is going to be the new way of exchanging ideas and learning tips and tricks.
Thank you, this is very clear, and I think it's a great opportunity to take part of this simulation lab, and it's a great opportunity for all the community to have all these opportunities outside the Congress, so during all the year, and really for the practice for our patients. So thank you, Francesco, and thank you, everybody. See you at Simulation Lab.